So, good day. Welcome to our lesson for today, which is the Laboratory Information Management System. So, we are the Group 2 and we are tackling what is Laboratory Information Management System is all about and what or where it is to be applied and what are its purposes and applications and especially the advantages and disadvantages of this management system. We have the following objectives that we will achieve at the end of the lesson. So at the end of the lesson, the learner should be able to define what is laboratory information management system and identify the functional requirement and features of LIMS, identify the core components of LIMS, enumerate the pros and cons of using LIMS, apply laboratory information management system in the medical field, and lastly, determine the importance and contribution of LIMS in modernization of management systems. So all of this, we will achieve this one and we are able to identify, determine, enumerate, and to apply this laboratory information management system at the end of the lesson.
An overview to Laboratory Information Management System. Technology has made a significant contribution to our society. It is clear that technology allows us to work more efficiently and with greater accessibility. The Laboratory Information Management System was created with this in mind. The Laboratory Information Management System is designed to assist in the processing of medical research data in order to improve departmental services and laboratory operations by saving time, reducing errors, and automating manual tasks and procedures. As we can clearly observe, there are numerous benefits of the LIMS. Not only does it benefit the workers, but also the patients, because it ensures reliable results and decreasing human errors. This results in efficiency and greater work output.
So first, let us define LIMS or Laboratory Information Management System. So what is Laboratory Information Management System all about? It is an information management system that is designed for laboratories. It helps to improve laboratory efficiency by properly managing the flow of samples and accompanying data. It also stores data for future references. It allows use and to store and organize data for various reports formats. An LIMS, for example, it automatically records data, saving time and reducing typographical errors. That is how useful LIMS is. And according to Gartner's 2016 Hype Cycle for Life Sciences, most of the top pharmaceutical laboratories are using LIMS. So it means that LIMS help us a lot to do the job easier inside the laboratory because it provides accurateness and efficiency in the lab. It also records information automatically, and just like what we have mentioned earlier, that it reduces typographical error and it automatically saves time. And LIMS allows us to effectively manage the flow of samples that is associated to improve the data lab efficiency. It helps us to standardize the workflows, tests, and procedures as it provides the accurate controls of the process. So it helps us to integrate, to automate collection of test data, reassuring that they are properly calibrated and operated by the staff or by the trained staff.
Objectives of LIMS. The fundamental goal of a LIMS is to increase the efficiency by reducing the number of manual processes. Your lab can automate workflows, integrate instruments, and manage samples and associated data with the help of LIMS. So, all relevant functions, such as automatic data capture, data entry into the system, and data storage, are the responsibility of the LIMS service provider. Some LIMS are more suited to be specific lab types than others, and they may not be suitable for all labs. So what are the functional requirements and features of LIMS? First is sample management. To ensure that the samples are not lost or mixed up, accurate and complete records are required. If the sample satisfies the allowed levels, a record should be kept. Workflow management can be utilized to save time by automating records and workflows. Remember, utilize to save time and automating records and workflows. Reporting. To make reports standard and personalized, they can be run and exported. But reports on the most frequently used instrument, the average sample handling time, and the list of backlogs are important in data analysis and the creation of future governmental recommendation. HR or electronic health records can store patient details as well as billing information. This characteristic should be considered by a health institution during the acquisition process because it will substantially aid in the management of clinical laboratory operations. In short, the electronic health record stores the patient details as well as the billing information. You should always remember that. Mobile. According to Gartner 2016, mobile LIMS offerings are limited. However, given the widespread usage of smartphones in laboratories, it is preferable that LIMS be mobile-friendly. ERP or Enterprise Resource Planning may help with viewing current supplies, estimating storage capacity, and managing location. You should always remember that ERP is the one that helps with the viewing, estimating, and managing. So that's all. Next.
So let's talk about Laboratory Information Management System, or LIMS. So if we hear about core components, it means it is a part of something larger, or it constitutes a larger whole. And this larger whole is the LIMS itself. Core components of LIMS involves what should be in a LIMS, and if that LIMS software is effective, or what are these LIMS softwares. So here's an example situation. So consider a lab where different researchers track samples in different ways, using everything from a traditional means like a paper and a pen to a massive spreadsheet. It will be difficult to ensure that the data isn't tainted by a human error. It could include missing results, data errors, and differences in data collected can all exacerbate any error. So it doesn't. These traditional means are not really reliable, and it's not credible to collect and store data this way. So that is why we have these laboratory information management system softwares to help us. So according to IEEE Global Spec in 2015, they specified but not limiting to these components of LIMS softwares. So first is electronic laboratory notebooks, or ELN. So these ELN are used in the laboratory where it is derived from the paper laboratory notebook. So this ELN, they make it easier to manage data by allowing for data security, auditing, and collaboration. So some ELNs can also keep track of sample inventories, reagent inventories, and other supplies, as well as equipment and maintenance schedules. So they kept these electronic laboratory notebooks in the laboratory, or they can use and bring it outside where they list everything from the staff to the machines and to the schedules. They list everything in this notebook, where it has a lot more advantage in the credibility and reliability of the ELN, or the electronic laboratory notebook, than in the paper laboratory notebook. Next is sample management programs. So these sample management programs ensure that data security and accuracy of all samples right from when they are received in the lab until they are processed, tested, and shipped out. So these sample management programs are focused on the samples. So they manage the samples as long as they are extracted from the patient. They make sure that it is managed well, it is stored well, and it is still viable. Third is process execution software. So these are software that guides the development of a machine if it is in a good condition or if it is functioning normally. So this process execution software, it literally means that it is a process execution how this machine is executing. So if it's helping the staffs or the staffs in the hospital, the doctors, the medical technologists. Well, if this if these machines are really effective and giving accurate results of tests from the blood samples. So next is records management software. So these are software that mainly focuses on the records or documents. So it it talks about how well they store or manage properly the documents or records that belong to the patients. So next is application to interface with analytical instruments or data systems. So this interface is how a system communicate or take action or collaborate with another system. So this will be discussed more later. So with they apply this interface with analytical instruments or data systems. So this involves a lot of systematic process. So data systems, like for example, the interface of a clinical instrument and a information system. So it will be discussed a lot more later. So, workflow tools. So, it is a set of procedural rules for managing and coordinating tasks in the lab between the people and the systems. So, this involves a lot of lists where you list the workloads of the staff and what is the scheduled time, like what should be the rule inside the laboratory, should be how should they coordinate with tasks with the systems, and a lot more. Next is client tracking applications, then best practice and compliance databases, and ERP software are also called enterprise resource planning software. So this involves a lot in the accounting department, the procurement, the project management, the risk management and compliance, and supply chain operations are all examples of software that organizations use to manage day-to-day business activity. So it usually involves the billing, the accounts receivables, like uh, like that. They manage also they have buyer risk management, how they manage the projects, and they supply like the operations in the laboratory.
Laboratory standards. So, as we all know that inside the laboratory, there must be a standards or a safety procedures that we must met or we must secure in order for us to enter or use the lab. So what are those laboratory standards that they set for us to met it before we can use the lab? So first, let us know um, who helps to promote the laboratory safety. So the occupational exposure to hazardous chemicals in laboratory standards was published in year 2011 by the Occupational Safety and Health Administration or OSHA. They published it because they want to help promote the laboratory safety inside the laboratory. So, a laboratory is a place where hazardous chemicals are used on a regular basis. So, we all know naman that inside the laboratory is there must be or there is a hazard or a risk So that's why they publish the occupational exposure to hazardous chemicals in laboratory standard because they want um, to help promote laboratory safety. So laboratory is a place where small amounts of hazardous chemicals that are not meant for production are kept. So doon gina-keep yung mga hazardous chemicals na hindi naman magagamit or hindi siya meant for production. So laboratory standard. So there is this is the following conditions that we should met when using hazardous chemicals in the laboratory or the laboratory standard. So first is chemicals manipulation should be limited to laboratory scale and handled by a single person. Multiple chemicals and procedures are employed. Any hazardous chemicals used that does not meet this definition is subject to other regulations. So if hindi na met yung mga hazardous chemical uses is meron silang another regulation na dapat na sundin. So examples are chemical use in the laboratory building maintenance, commercially available production, and quality control testing of a product. So when we say laboratory standard, it's ensure that laboratory workers are informed about the physical and chemical hazards na nandoon sa workplace nila. So it ensures that the laboratory is implementing the steps that is accrediting agency requires. So it helps us to know the standards or the procedures that we must met when we are inside the laboratory.
So now we are in chemical hygiene plan. So what is this chemical hygiene plan is all about? So chemical hygiene plan, after the standards have being passed or being applied in the laboratory, the chemical hygiene plan comes next. So this chemical hygiene plan is talks all about how or should be created that covers all aspects of the laboratory standards. The employer is responsible for ensuring that the chemicals used in the facility are purchased, stored, handled, and disposed of properly. So after, just like what I said, after you applied the standards, the CHP comes next because this will govern how we will store, how we will handle, and how will we properly dispose those chemicals in order to reduce the risk to the community or to the people working in the laboratory. So it encompasses the establishment of standard operating procedures, monitoring the work environment, statement of plan, designation of personnel who will handle CHP related activities. So this establishment of SOP or standard operating procedure, this tells us on how we will store, how we will handle, how we will dispose, where will we dispose, and how will we minimize the risk or hazard to it to the persons working in the laboratory, and then monitoring the work environment, especially um, applying the chemical hygiene plan. What are its hazards to the workers of the laboratory? What are its risks that may um, the laboratory worker will acquire? And next is the designation of personnel. uh, he will be the one handling the CHP activities if it is properly applied, properly followed, so that it will reduce the risk and to minimize the consequences of um the wrong move inside the laboratory. Next is the LIMS application or the Laboratory Information Management System application. So LIMS are used in the production of medical devices like joint implants and stents. So why we say that it is used? That it is used only in managing information inside the institution? No. LIMS are used in the production of medical devices like joint implants. What are these joint implants? We can see this or we can notice these joint implants to person who are immobile, the their legs were cut because of accidents or because they are diabetic, so they have cut legs. So these joint implants are the substitute or the artificial leg so that they can move or they can walk again. And this stents is used in blood vessels that are constricted because of the fatty deposits in the blood vessels to reduce the atherosclerosis or the arteriosclerosis. These stents are used to make the blood vessels dilate and to make the blood flow to a normal circulation. So they assist in the management of the manufacturing environment and the assurance of product quality by detecting changing trends through routine testing in order to keep the both environment and products sterile. So these are used in researches in medical devices. So it is used to manage the information within the research that can be used for future purposes. Next is the patient registration. So what is this patient registration? From the word itself, registration. This is the primary step upon entering the hospital because this step is used to acquire the demographics of the patient in order to identify that, oh, you are Luke, you are John, you are Juan, like that. So when a patient arrives at the hospital, the admission clerk will collect some basic information and direct them to a registration window. This includes the patient demographic data, the personal and contact information is collected. So upon entering the institution or the hospital, if you have the referral from your municipal hospital that they advised you to be referred to a larger hospital where the facilities are complete, or you can undergo procedures there. So all they need to do is to have this patient registration to acquire the names, the date, the birth date, your gender, your address, your present address, your permanent address. If you have this, if you are just a tourist here in the Philippines, or you live in other country, you just visited here, or you are a Filipino citizen. So this is the purpose of the patient registration. So billing, we all hear or we all heard this word billing. So when we say billing, money, money. So this is inpatients and outpatients and emergencies all have the same processes for generating the statement of accounts, allows you to keep track of the services your patients use, create and send invoices, and accept payments. So this billing, these are the summary of the procedures you undergone inside the hospital. For example, a patient undergone CT scan, and then that CT scan is worth 12,000 pesos. So that will be that will appear in your statement of account. So after or how many days of admission and you will now be an outpatient, so those procedures that you have accumulated inside the hospital will be tallied in your statement of account, and you have the summary of your billing. So wala pa dyan yung PhilHealth deduction if you are a PhilHealth member, wala pa dyan yung MaxiCare or other health institution or health plan, wala pa dyan yung Manulife, i-minus pa yan. And then, you will now receive the net or the net billing. When we say net billing, those are the billing that have deductions na sa mga health programs para yun na lang yung total na babayaran mo. So we are now in contract management. So most LIMS enable laboratory professionals to manage the billing and payment aspects of their activities, as well as create statistical and billing reports that are tailored to the laboratories and management's requirements. They set the parameters for flexible pricing schedule and allow for more focus on customer needs. So what is this contract management? This is what we call the process of maximizing the procedure for customers' needs while reducing the cost of it. So it includes the supervision of the sender's financial management and reminder of the unpaid balances from the previous visits. For example, you are admitted in the hospital and then you haven't paid yet for your previous visit, so it will appear in the contract management. This contract management, the main word here or the main idea here is to maximize the procedure while reducing the cost. Lastly, the account receivables. The personnel in charge of managing accounts receivables can easily extract information that was already available from the invoicing and contract management procedures, and thanks to the LIMS integration. So accounts receivables additionally can the LIMS can create accounts receivable reports, either specific or comprehensive, can be generated for reconciliation and auditing purposes. To keep an eye on the balances, the data can be exported to other accounting systems, and reports can be customized to meet the specific needs. So with these accounts receivables, we can encounter this if we are accounting or accounting students, or we are in a business field. What is this accounts receivables? These are the money that came into the institution, whether and they are acquired in from patients that are admitted or having checkup inside the institution. And how can they determine these receivables? As Importantly, the invoices or the resibo, the contract management procedures, yun yung mga basihan ng accounts receivables. And this is the basis of the commission on audit in auditing your institution. For example, if the audit uh, shows, or the results of the audit is not correlated with your files, kulang yung files, questionable yung pag-enter ng pera, your institution will be at stake because it will be closed, because it will the commission on audit will assume that there are discrepancies inside, there are corruptions that happen. So as much as possible, the receipts and other pertinent documents are needed to for auditing. So the main purpose of accounts receivables is for auditing. And then the reports generated from this, you can customize this based on the template that is required by your institution.
Work list and workflow. So this work list and workflow depends on the analyst in the institution's information system and the availability of instruments in the hospital's laboratory. So this LIMS assists laboratories in prioritizing current workloads. So in this work list and workflow, it focuses in the staff's or the personnel's current workloads. So they will uh, put here they will organize everything in this process. So it involves a lot of systematic process. So like for example, the personnel from the order filler or department system scheduler. So they will report to the reporting workstation to have this reporting work list. So like in the morning, they can administer or extract body fluids like blood in the patient. And the afternoon, they can start analyzing the extracted blood samples in the patient. How many are red blood cell, like that. For example, CBC, how many red blood cell, white blood cell, platelets, or if the platelets are involved, and hematocrit, like that. And in the evening, they can start administering these results. They can give it to the doctors, or if it's in stat, they can immediately administer the results. So they literally organize from this work list and workflow. This also features allow users to follow a progress of a batch of samples, and or multiple batches throughout their life cycle. Like as what you can see in the diagram or the figure. So this department system scheduler or the order filler may be the information system. They will provide the reporting work list, and they will pass it to the reporting workstation. Then this reporting workstation, this may be the nurses, the staffs, the receptionist, and uh, the medical technologist, the laboratory. So they will be the one who plan and take actions on the workload. And as they are finished, they will report the results back to the information system or the order filler. And this order filler can also provide through the procedure status in the image manager or archive. So this image manager may present images and evidence documents on the patients, where it can lead to the reporting workstation again for analysis, for the credibility of test results and reliability of the tests. Then again, this reporting station will report the results to the department's system scheduler. So in that, it will come to a uh, decision making and work for a diagnosis. So other features allow users to manage personal and workloads, allowing them to plan workload schedules and assignments, as well as employee information and training. Finally, the work list and workflow functions help to make the laboratory process more efficient.
So, the quality control in LAMS is the process of assurance of quality at every stage included in the automation system. So, it may also be called as a statistical process used to evaluate the analytics produced in the patient's results. So, the sampling product is continued after every successful stage until the end of the sample management process. So, the quality control is very essential in LAMS used in clinical laboratories as the results cannot be tampered with.
Barcode generation, printing, and reading. LIMS modules are frequently linked to a barcoding label generator. The barcode may be put on a label sticker and stuck on any object that requires identification. With the use of this technology, you can quickly locate the samples required for the procedures. U- Using the barcode scanner, this can also assist us retrieving the samples that needed in the operation.
So just an addition for this barcode generation, printing, and reading. So just before you get admitted to a hospital, the hospital have this barcode generating machines where they can print barcodes, and other hospital also prints QR codes. So this barcode will be um, put on the patient's wrist. It is for a purpose of identification. So they also have this reading, this barcode scanner, where if they scan this barcode on the patient's wrist, they will automatically identify the personal information of that person. As what you can see on the presentation, or what's presented in the presentation. So this barcode generation, printing, and reading are not just for the purpose of patient identification, but also it can be involved in the patient specimens, like the test tubes of blood samples or other body fluids, the tissue samples, or any laboratory tests. So for these barcodes will be used in case of emergency. So emergency situations like there's a mixture of test tubes of blood samples that interchange, or there's a missing, or so the samples of a patient is missing. So this can happen. It's possible that in a hospital setting this can happen. And this barcode literally helps if there is a barcode scanner, and if you scan this barcode, it automatically presents you the personal information of who these samples really belongs to. So next is inbuilt bidirectional interfaces with equipment. So bidirectional, so there's two directions, and these interfaces means that it is a software where a system and another system communicate with each other. So it depicts the user interface of a bidirectional medical laboratory equipment. So the information system and the clinical instrument must communicate in both directions. So each test orders, and specimen ID are downloaded by LIMS. The clinical instrument, on the other hand, uploads the same data for analysis. Instruments for microbiology, hematology, and other fields use the same method. So as what you can see on the figure, so these interfaces bidirectional. So clinical instrument and the information system. So they correlate with each other. They help each other to develop and function. So first, the information system will request tests on the clinical instrument, and these clinical instruments are presented with samples. So as the samples are being analyzed, so after that there will be a deliberation of results. Then these results will be passed through the information system, and this information system will report to the institution, or like for example like the doctors. They will help the doctors for having they will present a good quality data, or data quality that helps the doctors to have a good or confident decision making for the diagnosis of the patient. When a health institution uses this type of application, productivity is increased because the time spent programming the order into the analyzer is reduced, and accuracy is ensured because manual errors are eliminated. These machines now include features such as random access testing and barcode label scanning for specimens. So this is what LIMS, or Laboratory Information Management System, is all about. So this serves its objectives and purpose, which it increases the productivity of the staffs. The staffs are well efficient on their works, in analyzations of specimens and test results or samples. So the analyzation by using this LIMS software.
The advantages of LIMS, or the Laboratory Information Management System. Number 1. Elimination of human error. As we know, error can cause a lot of misdirect in the information. Modern laboratory information management system has now the power to automate the data and tasks in a single platform to avoid human error. Number 2. Time saving. With just a few clicks on the computer, you can manage and control the whole operation, and you don't need to manually check the samples where it is hidden. By the help of LIMS, or the Laboratory Information Management System, you can easily track it down. By doing these advantages, it can help you to save your time and effort. Number 3. Avoiding workload and stress. The modern LIMS today have the power to transform the functioning of laboratory by providing a greater control which is needed in the future. It is also convenient to everyone. Examples, if the doctor are manually approving every report, it can take them a lot of time. With the help of this LIMS, or the Laboratory Information Management System, you can manage your time appropriately and properly.
So, what are the disadvantages of LAMS? So, the first one is training. So, LAMS training is important for a number of reasons, whether it's learning how best to configure the LAMS for an efficient startup, or providing the key users in maximizing its daily use. So, training is a key element to both a successful implementation and effective continuing daily use of the LMS. So the second one is time to adopt to a new system. So LAMS projects that engage all the stakeholders early and encourage their input through an open communication. So take time to understand your needs and create a clear requirement specification, including the nuances and needs of the different laboratories and sites. So this small overhead will pay dividend over time with a more user-friendly system, higher productivity, and happier staffs. So the third and the last one is system crash. So while the LAMS system is running, unrecoverable runtime errors may occur, causing the system to crash and return it to the operating system level. So such runtime errors may be caused by the software itself. They should be corrected, or may be caused by the operating system.
So all in all, the main contribution of Laboratory Information Management System, or LIMS, into the modernization of laboratories is that It ensures the accuracy of the test results. It reduces or eliminates errors. It 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 drivens the staff's efficiency. It increases the productivity. Um, Overall, it provides better health services and in storing and collecting data from the patient. So it also involves technological advancements and the developing needs of LIMS software. So from traditional means of recording paper-based recording and results, from now we are in a digital age, or there are a lot of advancements in technologies, especially in the clinical laboratory, where there are a lot of new machines that can be used by medical technologists or other staffs and personnel in the laboratory that can make their work easily than in doing manual works. So that's LIMS softwares are all about. So this still ensures the capacity of managing and storing the data and the accurate of test results from samples.
So thank you for listening. That was Group 2, and this is our report about the Laboratory Information Management System. Thank you.